Rickets is a rare preventable disease, which results in the poor development of skeletal tissue. It can be inherited, however. The disease can also be obtained due to a severe vitamin D deficiency. It has been suggested that sunscreen may play a major role as a risk factor in the development of this disease in children. Rickets is the defective calcification of osteoid in children, resulting in the malformation of skeletal structures. The deficiency in vitamin D photoproducts that cause this disease inhibits the unique biological functions they perform within the skeletal system. The resultant visual symptoms include an anteriorly prominent frontal bone, an enlarged or abnormal cranium, bowed femur, tibia and fibula, kyphosis, scoliosis, and an anteriorly prominent sternum.
Vitamin D synthesis starts at the cutaneous level of human skin. When exposed to sunlight, subcutaneous 7-dehydrocholesterol in the epidermal skin cells absorbs UVB radiation, which converts it to the pre-vitamin D3. Pre-vitamin D3 then converts to vitamin D3, which is more stable. Vitamin D3 is then passed out through the cell membrane and diffuses via the dermal capillary bed, where it is taken to the liver and kidneys. Vitamin D3 is then converted to 1,25-dihydroxyvitamin D. This is the active form of vitamin D and plays the largest role in calcium and phosphorus homeostasis. As a result, it has a large impact on the process of bone formation, which is called ossification.
Ossification largely occurs in two forms, intramembranous and endochondral. Intramembranous osteoblasts are derived from the differentiation of mesenchymal cells and are responsible for laying down a collagen matrix osteoid that binds calcium salts and becomes calcified. Some osteoblasts become trapped in the bone structure, becoming osteocytes. Endochondral ossification results from chondrocytes secreting a cartilaginous matrix and dying when the matrix calcifies. A periosteal bud of capillaries and osteoblasts enters the cartilaginous shaft, forming a primary ossification center. The calcified cartilage serves as a template for osteoblasts to form bone towards the epiphyses. Secondary ossification centers are formed in the epiphyses, replacing calcified cartilage with spongy bone. Vitamin D deficiency causes a defect in the mineralization process where the collagen matrix remains flexible and doesn't calcify correctly. This increases the risk of fracture, and if the matrix becomes hydrated, the periosteal covering of the bones may swell outward. This swelling causes the pain and instability of bones associated with rickets. For this reason, maintaining adequate levels of vitamin D is important for the process of bone mineralization and reabsorption.
Although there are many causes for vitamin D deficiency in rickets, sunscreen has been shown to be a risk factor as it inhibits the photosynthesis of vitamin D. The application of sunscreen prevents this process by blocking the path of UVB rays. The block occurs due to the absorptive and reflective qualities of the chemicals in sunscreen, such as dioxybenzone and zinc oxide, which work in tandem to give broad coverage against the UVB spectrum of 290 to 320 nanometers. As peak synthesis occurs at 296 nanometers, sunscreen with a sun protection factor of 15 and above prevents the photodependent reactions required in healthy bone mineralization, which contributes to the development of rickets in children.
It is clear that there is an association between sunscreen and the development of rickets in children. Due to greater awareness with regard to sun safety and skin protection in general, people are not exposed to UVB as often as required for adequate levels of vitamin D production. A few minutes of daily, mid-morning sun provides ample exposure for necessary vitamin D production. Despite the relationship between sunscreen and rickets, it is important to be vigilant with sun safety, especially in a climate such as Australia.